What if I told you that one of the biggest reasons people over 70 fall has almost nothing to do with weak willpower, bad luck, or even age itself? What if the real problem is that your body has slowly stopped using one simple protective response that used to keep you upright automatically? And now, unless you wake it back up, one small misstep in the kitchen, one uneven patch of sidewalk, or one quick turn in the hallway could send you straight to the floor. That is not meant to frighten you. That is meant to wake you up. Because most adults in their 70s, 80s, and even 90s are never told about this. They are told to be careful. They are told to slow down. They are told to hold the railing. But almost nobody shows them how to retrain the exact response their body needs in the split second before a fall happens. And here is what makes this so frustrating. The exercise that helps reactivate that response is simple. It takes less than 2 minutes a day. You do not need a gym. You do not need expensive equipment. And once you understand why it works, you will never look at balance the same way again. So if the fear of falling is always somewhere in the back of your mind, if you catch yourself reaching for walls, countertops, furniture, or the arm of the couch more often than you used to, or if you have already had one fall and you never want to go through that again, then stay with me. Because today, I am going to show you one of the most important daily exercises for fall prevention after 70, why it works better than most traditional balance advice, and exactly how to do it safely at home starting today. Before we go any further, if you have not subscribed yet, I strongly recommend you do that now and turn on the bell notification, because this channel is built to help you stay strong, steady, and independent for as long as possible. And if this video speaks to you, type the number 1 in the comments below. If you feel like I could explain it better or cover something differently, type 0. I read your comments carefully, and they truly help me make these videos more useful for you. I'm Dr. Patrick, and I want to start with a question. When most people think about preventing falls, what do they usually focus on? Their legs, their shoes, maybe a cane, maybe walking slower. And yes, those things can matter. But the actual moment that determines whether you stay upright or go down often happens before your brain even has time to think. It happens in a fraction of a second. Your body starts to tip, your center of gravity shifts, and then, if everything is working properly, the muscles in your feet and toes react instantly to grip the floor, stabilize you, and help pull you back under control. That automatic reaction is one of your body's hidden balance defenses, and for many people over 70, it becomes weaker year after year without them realizing it. That is the part nobody talks about enough. You can have decent leg strength, you can be careful, you can avoid rushing, but if your feet and toes do not respond quickly when your balance starts to shift, your correction comes too late. And when correction comes too late, that is when a stumble turns into a fall. Now let me be clear. I am not saying your feet are the only thing that matters. Balance involves your eyes, your inner ear, your ankles, your hips, your core, and your brain. But the feet are where your body meets the ground. They are your first line of communication. They are the first place your body senses danger and the first place it tries to create stability. And when that connection becomes dull, delayed, or weak, everything above it becomes less reliable. Think about it like this. If you start leaning forward unexpectedly, your body should not have to hold a meeting about what to do. It should not need a long conversation between your brain, your knees, and your hips. It should react instantly. Your toes should press, your foot muscles should engage, your ankles should respond, and your body should pull itself back before the fall ever happens. That is how it is supposed to work. But with age, years of stiff shoes, flat indoor surfaces, less barefoot time, less movement variety, and less direct foot training can all weaken that response. The muscles get lazy, the nerves become less responsive, the timing gets slower. And many older adults do not discover that until the day they trip and realize their body did not catch them the way it used to. Now here is the good news. This response can be trained. You are not too old. It is not too late, and you do not need a complicated routine to begin improving it. In fact, the simple daily exercise I want to focus on today is something I consider one of the best starting points for adults over 70 who want better balance and fewer falls. It is called the toe lean. And if you do it safely and consistently, it can help reawaken the exact reflex most people need more of. But before I explain how to do it, I need to give you a serious safety warning. Please do not skip this part. If you have severe osteoporosis, Parkinson's disease, vertigo, a diagnosed balance disorder, significant neuropathy in your feet, recent surgery, or a recent fall that caused injury, please speak with your doctor or physical therapist before trying any new balance exercise. These videos are for general education and fall prevention support, but your body may need a more customized approach. Also, never do this in slippery socks on a hard floor. That is a recipe for trouble. If possible, do it barefoot so your feet can fully feel the ground. If barefoot is not safe or comfortable for you, wear shoes with a secure, non-slip sole. And most importantly, always have a wall, corner, or sturdy chair nearby for support. Not because you expect to fall, but because safety allows your body to practice with confidence instead of fear. Now let's talk about the exercise. The toe lean is simple, but do not mistake simple for weak. This is not busy work. This is not fluff. When done correctly, this movement directly trains your body to recognize a forward shift in balance and use the feet and toes to correct it before a step or fall happens. Here is how to do it. Stand facing into the corner of a room where two walls meet. This is what I like to call your safety corner. The reason I want you in a corner is simple. If you lean a little too far, the walls are there right in front of you to help protect you. You can also place a sturdy chair in front of you for extra confidence if needed. Stand with your feet a few inches apart, not wide, not touching, just comfortably close. Keep your back straight, shoulders relaxed, and chin level. Now gently lean your whole body forward from the ankles, not from the hips. Not by bending your waist. Your body should move like one solid plank. As you lean forward, you will feel your weight shift toward the front of your feet. And this is the important part. Before you lean so far that you need to step, let your toes grip the ground and help pull you back to center. That is one repetition. That is the movement. Lean forward, wake up the toes, return to center. Do it slowly, do it with control, and do not rush through it just to get the repetitions done. The whole purpose is to teach your nervous system to notice the shift and respond properly. Start with 8 to 10 repetitions. Rest. Then repeat that set 1 or 2 more times. That is it. That is your foundation. That is the simple daily exercise I want more adults over 70 doing regularly. Now you might be thinking, that seems almost too easy, and I understand that reaction. But remember, the most important changes in fall prevention do not always come from the hardest exercises. They often come from the most specific ones. This exercise is specific. It targets the exact pattern most people need when they begin to tip forward. It is not about exhausting you. It is about restoring timing, coordination, and response. And that matters much more than looking impressive. Let me explain why this works so well. Most falls do not happen while someone is standing perfectly still in an ideal position. They happen during transition. They happen when you start moving, reach for something, turn, step, or react unexpectedly. And in those moments, your body needs fast information from the ground. The toe lean improves the connection between the feet, the ankles, and the nervous system. It teaches your body to trust that front edge pressure again. It teaches your toes to participate instead of staying passive. And over time, that can help you feel steadier not just during exercise, but during ordinary life. Getting up to answer the door, walking to the bathroom at night, stepping off a curb, reaching into a cabinet, turning around in the kitchen. These are the moments that decide independence. That is why this matters. Now let me tell you the 3 most common mistakes people make with the toe lean. Mistake number 1 is bending at the waist. If you bend at the hips, you change the exercise completely. You are no longer training the forward balance response the same way. So keep your body tall and move from the ankles. Mistake number 2 is leaning too far too fast. This is not a trust fall. You are not trying to scare yourself. You are trying to create a small, controlled balance challenge that your body can solve safely. Mistake number 3 is locking the feet and ignoring the toes. If your toes are just along for the ride, you are missing the whole point. You want to feel them gently engage with the floor as you come back. That is the response you are trying to rebuild. Now, if the full version feels too difficult at first, that is perfectly fine. Here is how to make it easier. Stand with your hands lightly touching the walls in front of you. Make the lean very small. Even tiny forward shifts can be useful in the beginning. The goal is not a dramatic lean. The goal is a clear signal and a safe correction. If, on the other hand, it feels very easy after a week or two, you can progress it carefully. You can lean a little farther. You can pause for a second at the front before returning. Or you can hold a very light object against your chest to increase the demand slightly. But only do that if you are completely steady and confident with the basic version first. And please hear me on this. Consistency matters far more than intensity. Doing this for 2 minutes once and forgetting about it for the next 5 days will not help much. Doing it briefly, safely, and consistently every day is where the change happens. That is how balance improves. That is how reflexes sharpen. That is how confidence comes back. In fact, I want you to think of this less like a workout and more like brushing your teeth. Small, daily, non-negotiable, because the body learns through repetition. Your nervous system responds to reminders. And every time you do this exercise, you are sending your body the same message. Wake up, respond faster, protect me better. Now, there is another important point I want you to understand. The reason so many older adults stop trusting their bodies is not just because they fell. Sometimes it is because they almost fell. That near miss changes something. You trip a little. You catch yourself on the counter. You wobble getting out of a chair. You recover, but your confidence takes a hit. And once confidence starts shrinking, movement usually shrinks with it. You walk less. You reach less. You avoid stairs. You hesitate more. And unfortunately, that often creates the exact weakness and stiffness that make falls even more likely later. That is why simple daily exercises like the toe lean are about more than mechanics. They are about reclaiming trust. Trust in your feet, trust in your reactions, trust in your body's ability to correct itself. That quiet confidence matters more than most people realize. Because when you move with confidence, you move more naturally. When you move more naturally, your balance often improves. And when balance improves, fear begins to loosen its grip. Now, I also want to say this. Please do not wait until you feel unsteady every day to start. The best time to train this is before the next fall, not after it. The best time is while you can still practice safely, gradually, and on your own terms. That is how prevention works. It does not wait for disaster. It builds protection ahead of time. So here's what I recommend. For the next 7 days, do the toe lean every single day. Just 8 to 10 slow repetitions, 1 to 3 sets, always with support nearby, always with control, always within what feels safe for your body. At the end of that week, ask yourself 3 simple questions. Do I feel more aware of my feet? Do I feel more stable when I shift forward? Do I feel even a little more confident moving around my home? If the answer is yes, keep going, because small improvements in the beginning often lead to big changes over time. And if you are wondering whether something this simple can really matter, let me remind you of something important. A fall usually happens fast, but fall prevention is built slowly, one safe repetition at a time, one stronger correction at a time, one better response at a time. That is how independence is protected, not with panic, not with fancy equipment, not with one giant effort, but with steady, specific, repeatable action. And that is exactly why I wanted to bring this to you today. Because if you are over 70, one of the smartest things you can do is stop waiting for your balance to magically improve on its own. Give your body the signal it has been missing. Wake up the reflex, train the response, and make this tiny daily habit part of the way you protect your future. If this helped you, type 1 in the comments so I know you are with me. And if you want more simple health guidance like this, subscribe and stay close, because I have a lot more to share with you. I'm Dr. Patrick, and I want to remind you of one last thing. The goal is not just to avoid falling. The goal is to keep living life on your own terms, to walk through your home with confidence, to get up without fear, to step outside without hesitation, to protect your freedom for as long as possible. And sometimes that begins with something as simple as teaching your toes how to save you again.